Hello, everybody. It's Tuesday night. It's 7 o'clock, and we are live. Hello, everybody. This is Veronica Brockwell with V-Talks, and welcome to the show tonight. I'm so excited that we have Hannah Chapman and Breanne Langkamp here from Seahorse Behavioral. We're starting another 3-part series, and this one is a little bit different. Tonight is going to be healing childhood trauma, tapping into our inner child, and then we'll have 2 more after that. And I'm very excited to have them on because I think all of us have childhood trauma, and what we're going to learn is the impacts that it has on our personalities and our behaviors. And then we're going to learn how to maneuver through these things. So I'm going to bring on the experts. I'm going to be right here learning with you. And welcome to V-Talk, Breanne Langkamp.
Hello.
And Hannah Chapman from Seahorse Behavioral. How are you, ladies?
Great.
Good. Thanks. How are you?
We're a little discombobulated tonight, right? I was like, where are my notes? Where did I put them? I am so sorry. I know what we're talking about. I just have a lot of stuff in front of me right now. Yes. So welcome again. I'm so happy to have you from Seahorse Behavioral. And but before we get started, I would love it if you could introduce yourselves to our new any of our new audience members. So Breanne, I'll start with you.
Sure. I'm Breanne Langkamp. I'm an adult and psychiatric nurse practitioner, the owner of Seahorse Behavioral, and we're really happy to be here. It's really been a great time to talk about some of these different topics on Talk. So thank you so much for having us.
Sure. Hannah?
Hi, I'm Hannah. I'm a psychiatric nurse practitioner. I work with Breanne at Seahorse Behavioral. Excited for another 3-part series. Thanks for having us.
Yes, and we had a lengthy meeting not too long ago. It was actually quite fun about this topic because I think that we, as I said earlier, we all have childhood trauma, and the effects are so far-reaching. So I think that really what I'd like for you guys to talk about first is what is childhood trauma?
Yeah, and Hannah, I think you had like a really good definition of what trauma means, that is really easy for someone to understand.
Yeah. And so really trauma is an individual. It's an individual to the person who experiences it. It essentially can be any overwhelming event in childhood, which seems very broad, but it's intended to be that broad because it, like I said, everyone's experiences are individual. And that's kind of how you have to start by looking at trauma, is through the lens of the person who's gone through it. You could put 2 people in the same exact scenario, and one person could come out feeling that it was traumatic and they'll have everlasting effects from it, and someone else might not have that same experience. So,
and it's because it's all relative, right? And I actually even say this a lot, that there's a spectrum, depending on what the individual has experienced anyway, right? Like your worst trauma is, the worst thing you've ever experienced is the worst feeling you've ever had, right? And so, all right. So let's talk about the types of trauma that one can experience.
Yeah, and I think it's true, like with the spectrum, like you're saying, I think in all of the shows that we've done, we've talked about a spectrum of depression, a spectrum of bipolar disorder, mood disorders. And, I think that's really true for trauma too. We have religious trauma, we have medical trauma, we have physical, sexual, emotional trauma, there's a lot of different subcategories of trauma, and it is important to put that into perspective that someone's trauma may not be in one of the main categories. It may be a subcategory of trauma, but to them, it can be just as severe as really experiencing something in one of the main categories of trauma.
All right. Well, I'd like to go through the categories and just get your take on these. So we have the first one we have is emotional trauma. Can you give me some examples there that a
Yeah.
child might experience?
So, something that comes to my mind, like immediately, would be like a child growing up in a home, maybe with parents who are like emotionally neglecting them, maybe being verbally abusive, telling someone you're not good enough, you're a bad kid. It's inflicting emotional damage and harm on to the child. It could be, you know, manipulation tactics, really anything that has an intention of disturbing someone's like emotional well-being.
Okay. Do you want to add to that at all, Brianne?
Yeah, I think too, think about growing up with a parent who maybe has some traits of, maybe they themselves have some mental illness or um, really have mood fluctuations, anger, irritability. You don't know who you're coming home to, the good mom or the bad mom. Is it Mr. Dr. Jekyll, Mr. Hyde? That is a scenario where really someone might be walking into some emotional traumas, as Hannah said. You could be coming into really a big negative feedback loop, and you take that in, and you can start to feel anxious and have panic attacks and really express that emotional sense of feeling that trauma.
All right. The next one's interesting. And I feel like maybe, it might surprise some folks, but some might be happy we put this up. Religious trauma. Can you let our audience know why this might be something that can cause trauma for a young child?
Yeah, I mean, I think recently in the news, we've seen instances of families that are maybe a part of cults and living that life of really a very strict regimen, and what that means to the child. What if they don't have a say? What if those aren't their beliefs? What if there are beliefs in there that maybe are endangering to that child? I remember as a student, we had a case of a child whose father was part of a cult like group out in Western Mass, and they would sacrifice animals and have the children be there. And, it was just unbelievable, and I think, working with this child was so difficult because there were so many feelings and emotions that came from a belief that a parent really felt strongly, and he loved his father, and that was really hard because it was a divide, and he ended up being removed from the home because it wasn't a safe environment for that child to be in.
And one of the things we talked about when we had dinner the other night is that we like to share our experiences with the audience because it, I think, makes them feel a little bit safer that gosh, these three ladies up here have all experienced situations that either childhood trauma or just things in their lives, we all have, and we're trying to make mental illness okay, like it's normal, get help if you need help with anything, right? So one of the stories is that I am going to share, and I was really on the fence about sharing, but I want to help people. So I grew up, now that we're talking about religion, I grew up in a really religious home. And I'm proud of that. I'm proud of my parents. I grew up in a anything. Um, but my dad very much put in time, and his life was very much the first group that people went to, was very hyper focus on the book of Revelation and the end of days and the rapture of the church and the 7-year tribulation and World War III. So imagine as a little girl, pretty much every day, my father would talk about how it was time and it was going to be within 7 years. And if we didn't make the rapture of the church, if you didn't make it, if you weren't a strong enough Christian and you didn't pray every single day and you didn't make that, you would have to take the mark of the beast.
Yeah.
666. I know this sounds like absolutely like, imagine being a little girl and he had excellent intentions. He really believed all of this and it could possibly happen, but this was in the 70s
Mhm.
and he has passed away since. My mom has passed away, obviously, and it never happened during their lifetime. But I had extreme trauma from that
Yeah.
and didn't realize it until, later on in my life that that's what it was from. But I didn't ever feel safe. I was afraid every single day. And I really, really believed
Mhm.
everything to the letter, right?
Yeah.
So that's an example of religious trauma, and they had good intentions. And we're not trying to tell parents that, everybody's doing the best that they can and they love their kids. And I'm still a Christian. That hasn't changed, but it was the way it was handled back then, you know?
No, thank you for sharing because you're right. I think
Yeah.
as a child, I think if you had some of that background knowledge about how
Yeah.
you could talk about it or what that
Mhm.
meant, it
Sure.
would have shaped the situation in a totally different way. But as a child, we don't know. And I think that's
Yeah.
why it's so important to identify these different things right now.
Mhm.
Because if we can give people coping strategies that maybe can't get out of that situation, it's easier to deal with it and pull from that resilience and pull from the
Mhm.
experience itself versus letting it turn into something
Mhm.
that just snowballs and snowballs into mental health issues and medical
Yeah.
issues and the anxiety and the panic and just
Yeah.
so many other aspects of mental health and the physical health and the combination of the two.
And we're gonna get into that later too. We're gonna talk about, the repercussions for this. But I do wanna say again, I wrestled with telling that story because I have to tell you, my father was an amazing man and he never would have done anything to
Oh,
hurt me at all. Like he just wouldn't, but he just didn't know, and it's
Yeah.
his dad was very strict in that way too, right? So he
yeah.
learned some of that. He grew up that way. And I think the most important thing is that we're talking about it and we're talking about the effects
Right.
that it can have on your kids, right? All
Yeah.
right. So we're going to go, we're we moving on from this one and we're going to go on. Yeah. Okay.
Yeah.
So we're going to go
Thank you.
on to sexual trauma.
Yeah. So, I mean, I
Yeah.
think this one is a little bit more, of course, I mean, self-explanatory.
Yeah.
But, I think in the case of children, I think, of course, we think of instances of, you know, um, incest or childhood molestation from adults. But, once we even get into like early adolescence, of course, um, instances of rape, uh, even, which can happen at any age. Um, so that's kind of, I don't know that I have to go like too deep
Yeah.
into that one because
Yeah.
I think it
I think,
explains itself. But
of course.
um, and I think as we get more into talking about the impacts, I think this one in particular, I think is interesting because it goes both ways as far as the victim and the perpetrator. Oftentimes, the victim will have their own repercussions, and a lot of times the perpetrator, this is their own repercussions of their own trauma. So this one's a little interesting, I think, in the sense of truly just like that kind of extent to which it can kind of affect both parties involved. Not that it is any sort of excuse, but it's just an interesting something just to kind of think about, right? The connection that we often hear about those who are committing these things are oftentimes victims themselves.
Yeah.
So, and we'll get into more of that. It's a 3-part series, right?
Mhm.
So we're going to talk more about that. I think in our second show, we're going to kind of dive deep a little into some of these disorders and the mental illness that goes along with childhood trauma. So, so let's talk about the signs of trauma.
Yeah. So, sorry.
I know I should be better about it.
No, that's okay.
Yes, Hannah.
I'll start with the first. We're gonna go through some.
Raise your hand.
No, this is appropriate because I'll do the preschool one since I'm raising my hand like I'm in school.
That's all right.
So we're gonna talk about it, according to age group, because it actually can be different according to the age of the child. And so when we're talking about little kids, preschool aged, the most common things that you're going to see are fear of separation from parents. The kids that we're not just talking like, I don't want to go to school. We're talking, I'm having an absolute meltdown, having to be dropped off at school because I'm afraid of being away from my parents because of something happening. Sometimes it can be lack of appetite, or like actual like weight loss. Children with emotional outbursts, crying a lot, screaming a lot, nightmares, wetting the bed, are probably pretty common. Some of the more common signs that you might see in a kid who's in that preschool age group.
Yeah, and then as we get to elementary, I think we start seeing an overlap of those symptoms that we see in the younger age group, but really we can start separating out some of that anxiety that's there. Maybe they don't want to get on the bus. Maybe, again, they're having the emotional outbursts and the fear of, I don't want to sleep in my own bed. I want to sleep with my parent. I don't want to go anywhere. Just even irrational fears of, the sound of thunders, that's going to come get me. And just taking in a lot of their environment and putting it into a place that they might feel like it fits for them, which might really be the center of fear. So, I think just being mindful of where that anxiety is and how it's being manifested. Is it through the stomach aches, going to the nurse every day? I don't feel good. I just, my stomach hurts. My stomach hurts. We have a lot of serotonin in our stomach as we do in the brain. And, so we often see that brain gut connection. And a lot of, when we see teens, adults later on in life, they'll say, I was that kid that lived at the nurse. I was there every day. I had stomach aches every single day, and then we can kind of get into more of the details of why that was. And oftentimes it was related to some type of adverse childhood event that occurred.
Yeah. So then we get into.
So this is more your high school aged kids. I think this is probably more where we're truly seeing what I think we probably think of as more classic manifestations of trauma. And these are going to be in your middle school and high schoolers. So, the actual labeling of I'm, feeling depressed, feeling anxious, engaging in self-harming behaviors. And self-harming behaviors could be a number of things. It could be, punishing, yourself from eating disorders, or actual physical self-harm, substance use disorder. This is where we start to see a lot of these things start to come to the forefront as we get a little bit older.
So it's incredibly it's incredibly interesting to listen to all of this, because I'm sure many people in our audience have been through this themselves or their children are going through it
Yeah, and
now.
even into the geriatric population, I specialize in geriatrics, and if you think about that generation of someone being in their late 70s, 80s, that, some of that physical, sexual, emotional trauma that they experienced, maybe from family members or friends, really was kind of pushed under the rug, and it wasn't okay to talk about, and especially within family members, that really was pretty common among when I'm hearing about certain traumas within the geriatric population, and
Wow.
it still affects them today. They're just like, how come this happened to me? And I'm thinking about this now because I'm turning that into that last stage of life, and or end of life, and how that impacts your end of life experience if you've gone that long without really talking about your trauma. And you know I had someone who's like in her mid 80s who was like, "You're the first person I've ever told about my trauma." And I'm like, "What?" Like, you're in your
Yeah.
mid 80s and you've had to deal with this alone all of your life.
Are you, I just saw, are we good? Reception
Yes.
good now?
Yes.
Okay,
Yes.
good.
Yep. Yep.
All right. Thank you. I just, was it
I
just
just
brief?
saw it a little while ago too. I think it was just a minute
Yeah.
or so. Yeah, it was fine.
Okay, good.
Yeah, that wasn't a problem.
Yeah, because it wasn't out on my end with you guys. So we just want to make sure that this is a good podcast here. Yeah, I think that is incredibly sad for me when I hear that. That this stays with you forever.
Yeah.
Yeah.
Unless you deal with it.
Yeah.
And I'm so glad that things have changed now, that it is okay to talk about these things and it is okay to get help, and that's what you guys do. you know so go ahead.
I do want to say too, like one thing that I always think is interesting is the timing in which these events are happening is really kind of what impacts like what when it actually ends up causing problems later in life. So, you know, maybe a kid who's maybe an adolescent, right? What do we know is like one of the most important things during that time is our connection to others, right? Finding who you are and where you belong in this world. And if certain things are happening, like bullying and things like that, at that point in your life, you might see later on in life this person having trouble in relationships, or, not being able to form like friendships or bonds with others because, during this vital point of brain development and social development, they were lacking in that area. And you'll see that effect like later on down the road. I remember when we were in NP school and learning about, different theories and whatnot. I always found that one to be the most interesting, of looking at when these traumatic events are happening. A mother, like, maybe someone who's abandoned as like a little baby, like even as young as like, there's amazing like studies that have even looked at like infants, and
Okay.
when we're not even technically supposed to remember, our bodies remember trauma, and incidences of kids who maybe their parents had severe mental health issues or substance use issues, and maybe that child was like neglected, and even if that child was then adopted into like a loving and caring home, that child then going on to develop like serious like mental health disturbances themselves or physical issues, even though you couldn't possibly remember what happened to you when you were 3 to 4 months old. But it's just amazing how, your body does like really remember these things that happen, even if it's not necessarily a conscious thought.
All right. Well, so we're gonna talk about the impacts of childhood trauma on kids, and the first topic is learning challenges.
Yeah. Well, I think, sometimes it might come across as I have ADHD or I have memory issues or I'm forgetting. Do I have dementia? And, I think people forget the cognitive impact of
Okay.
having some type of trauma in their life. You can have manifestations of brain fog, inattention, difficulty with word finding, which then can impact your learning environment. Anxiety alone, can be present in taking tests and being in school and making friends and the social anxiety. So I think that's a big piece of it, and definitely to tease that out when maybe a child is kind of having that thought of, parents or teachers identifying, do they have ADHD? I mean, that's really important to kind of look at that piece of it.
And how do you determine that at Seahorse? Like, how would you, as you use the word, tease that out? Like, what are some things that you do over there to
Yeah, so
kind
we do like
of?
parent screening, teacher screening, and we're a big proponent of neuropsychiatric testing, where we would refer out to a psychologist to do a really more in depth testing so that we can know what we're treating. We don't certainly want to put a child on medication if that's not necessary. We
Mhm.
want to be able to provide the right care at the right time. Maybe it's just learning teaching those coping strategies. Maybe it's anxiety manifesting that way or depression manifesting that way. So that's really one of our like big tools that we use is just to try to get that neuropsychiatric testing done.
Yeah. And, we kind of covered the increased use of health services, going to the nurse, those types of things, right? And then what are some other um, impacts there?
Yeah, and I want to add to that,
Hmm.
we encourage increased use of mental health services, right? Like if you're having trouble or you're struggling, we want you to reach out for help. Um,
Sure.
but of course, like, I think like to Brianne's point, I think it's more so like the, overuse of things in the medical system um, that may not be appropriate, right, for what's actually going on. It's not that we don't want people asking for help, but more so, are we actually treating the right thing, right? Are your stomach aches really stomach aches, or is there
Right.
something more going on, right?
And
And
we
then, oh,
talked
sorry.
about that too, right? They're go a
Mhm.
lot of times they're treating, the symptoms, and they're going
Yep.
to their primary care physician and they're being treated for stomach aches, but they're not really getting to the root cause,
Right.
right?
Right.
And vice
Exactly.
versa, maybe there
Mhm.
is something going on,
Right.
it's you can see a first grader having an ulcer because of the stress in their lives,
Right.
it's not always that these kids are going to tell their parents what's going on.
Yeah.
They might be hiding this from you. You might not even know what is happening, especially if it's a trauma happening outside the home, at school. This is National Awareness Month for bullying, and I think that's a huge population who maybe as a parent, as a guardian, as a friend, maybe you really don't know what truly is going on with that child who might be getting bullied, and it can manifest into an ulcer, and they're having stomach aches and they're having some maybe some bleeding issues from the ulcer. So it's important to kind of look at it from both angles and not dismiss something because it's just anxiety, that if you do a thorough assessment, then, and we do that as well, we'll do labs, we'll really try to be as thorough as we can and rule out any medical first because
Yeah.
it does, it's, there's so many medical issues that can come from
Right.
dealing with a chronic stress that you just can't, get out of. And
Right.
sometimes these bullying episodes can go on for months at a time, and they're trapped in this.
So, Brian, I don't know if you're comfortable. This was, we all had some stories we wanted to share tonight, but we weren't really sure what we were going to do,
Yeah.
because it's very private, but now
Yeah.
we're kind of putting it out to the universe. Um, are you comfortable sharing this bullying story with us?
Yeah. So,
This might be a good
yeah,
time,
yeah. So
I'd love to hear it.
yeah, my daughter was in the first grade, and so she was the new girl in the school, and basically it was at a private school, so they were able to wear like special socks and special shoes to kind of set themselves apart with their uniforms. And one of the little girls in the class got became friends with her, but then became very jealous of what she was wearing, and actually like locked her in the bathroom, told her she was going to kill her. And
How
in
old was she?
first grade.
Oh my
And
gosh.
then
Can you even believe it?
the
Oh my gosh.
mother of this student actually came to the playground while she was outside playing with her class on the playground, and came up to her and said, "If you say anything more, I'm like, you're going to get hurt." And the teachers basically, like all the family, everybody gathered together, and they're like, we stand by you guys. She should be expelled from the school. I think my daughter was like the third or fourth child that this happened to. All the other kids ended up leaving the school, and it was the after school teacher who like just came to us and said, their parents donate a lot of money to the school. You better just leave. Like, you should just leave. Like, I'm with you. Like, this isn't right, but this isn't going to stop, and you guys should probably just leave. And we went through the physical stuff, weight loss, and just
At that age.
headaches. Yep, weight loss,
Oh my
headaches. I mean,
gosh.
significant weight loss, and just. And finally, she felt so trapped in the situation. She literally she packed her bags, and she said, I'm going to Grammy's house. Like, I can't deal with this anymore. And it has long-term effects on kids. From that point on, like, she didn't want to wear dresses anymore. She didn't want to have anything that had attention to her anymore. It just, and it's trickled to like who she is now. I think it's a huge impact, a huge medical, emotional, impact on someone that has to go through that. And what could you do? Like, she was in a situation that was really like, she was stuck. She really truly was stuck.
And how did you feel?
Awful. Like, it's awful as a parent. It's
I mean, how and you handled it the best you could,
yeah.
right? Like,
We we moved.
Right.
We had just
Yeah,
bought a house,
like,
and we moved. We're like,
yeah.
this is the best thing for her, and it was.
Mhm.
And I think she was able to be with like her family and her friends and her cousins, and it was that was the right thing for us to do. But what if we couldn't do that? What if we couldn't sell our house? What if we didn't have resources to move? And that's the other side of it. Thank goodness we could, but there's a lot of people that can't. And I think it definitely shapes the work that I do now, and
Yeah.
wanting to help other children, and identifying it, and being a support for a parent too that has had to go through that.
Mhm. Right. We have children becoming more involved with child welfare and juvenile, service systems. Yes, of course. That's clearly another impact for children that have gone through childhood trauma. Do you want to elaborate on that?
Yeah, I mean, I think, um, we're, I think what we're referring to is like, more involvement in, Department of Child and Families,
Mhm.
kids getting into actual like legal trouble because of
Mhm.
behavioral issues.
Mhm.
But honestly, like, even in addition to that, it could be kids, starting to, even when I just think becoming more involved in like punitive situations, right?
Mhm.
So suspensions, expulsions from school, really kind of, unfortunately, a lot of things that really set people on a path of potentially like really having some serious impacts on their life later down the road, especially, I mean, we all just know that if you get involved in the criminal justice system, it's really hard to get out of it. It's a really tough cycle to break. And when that starts that young, um, that's That's tough.
It's another trauma. Like, it's another
Right.
trauma.
Oh,
on top of
exactly.
trauma, just going inpatient,
It's
to the
I
traumatic.
can't
hospital.
even, I
It's a
really
trauma,
like,
you know,
sure.
it's
Yeah.
just that, and you're trying to do the right thing, as a practitioner. Sometimes we have to send patients inpatient to be safe, if they're a harm to themselves or a harm to someone else. And, and we hear that so often that, they felt like that was traumatic for them. And it's an awful feeling, because what do? You want to make sure someone's safe, and and you try the best that you can, but sometimes that is the place that they need to be safe. And but it's
Well, yeah, I mean, if they're practicing self-harm, you don't have a choice.
yeah,
Right.
yeah,
Right.
It's just one of those things that you have no choice,
yeah. And I wish it would change, because
Right.
Yeah.
you know if someone has a good experience, it's the complete opposite. I really, I got a lot out of that hospitalization, and I wouldn't mind having to go back to that, but that's really not the norm. It's more of the norm of, I lie and say I'm not doing these things to not be sent to a place that I felt like was traumatizing to me. It's just, I think, due to staffing and the
Yeah.
situation, and maybe they're, a young teenager put on a floor with, adults mixed into it, and pretty significant severe mental illness mixed in with
Mhm.
other, maybe not as severe. And, and that's, if you've never been in the presence of that, that is, you might not know what to do about that. That can be very scary for
Mhm.
a teenager to see someone with significant mental illness, and who's, you know delusional, having hallucinations, and not knowing what that means.
Yeah.
Sure. And I know several people that have had families and kids that have eating disorders, and it, they've been in these facilities, and I they don't always they're not always honest, and then it continues and it continues, and then they get out and they say what they have to say,
Mhm.
to get out, because they're not the treatment isn't exactly what they need,
Yeah,
you know? So it's so deep,
it
right?
is. It is.
Yeah, eating
And
disorders, I mean,
yeah,
it's just
there's so many. There's so
yeah.
many circumstances that
Mhm,
require that higher level of care, and unfortunately we just don't have the system in place to help manage it. I mean, it's a
mhm,
trauma to sit in the ER for 3 days while you're waiting for a bed to open up. And it's, with the medical traumas, it's not even that there's an adverse event that happened from it. It's just maybe the act of having a medical procedure that went well, that was fine. It's just, so I think, as you said, there's the spectrum of trauma is so great, and it doesn't
mhm.
always have to be something that actually had a negative outcome to it. It
Right.
could just
Right.
be whatever that experience was.
So let's talk about PTSD, because uh, that is definitely a repercussion of having childhood trauma. Um, you want to talk about that, Hannah?
Yeah. So, I mean, I think when we think about, like I said, trauma could be many different things. There are such things as like acute trauma. In the world of psych, we live by timelines. And so essentially, anything that really is more than like 30 days out from the traumatic event, with these symptoms of maybe having flashbacks or mood dysregulation, is really when we get into more of like chronic traumatic stress. So what we know as PTSD. And I think, when we hear PTSD, I think a lot of us right away, we think of, what comes to my mind first when I hear the term PTSD is like war veterans, right?
Sure. Mhm.
The soldiers who are at the grocery store and someone knocks something off of a shelf and they hit the floor because they flash back to maybe being back in a in a war situation.
Mhm.
But it can be anything in those situations. So it's, like I said, it's a chronic condition. And so that's where we kind of get into like, well, how do we treat that differently? Looking at like certain types of therapy tend to be really helpful. Um, I guess this is probably a good place for me to share my experience with
Yeah.
what I would consider, again, like I think we think of them as more severe, right? But so I was a bedside nurse at the time of COVID, and the unit that I worked on had a lot of elective surgeries, and they all got canceled, and so I was pulled to work into the COVID ICU alongside the best nurses out there. I was very fortunate to be with an incredible team. But I'm sure everybody remembers when like we were all trying to find like, Clorox wipes or Lysol wipes, and you couldn't get your hands on anything. And I remember being panicked because I was like in the ICU and having to change out of my clothes, and all I could get my hands on. I'll never forget. Shout out to a certain store. I don't know if we're allowed to say brands, but there was a store. Shout out
They'll
to
love you.
Shout out to BJ's.
All
I
right.
will never, ever forget. They had a specific opening hour in the morning for healthcare workers. And I walked into the front of the store, and there was an entire like huge like display of Clorox wipes. And I was like, oh my God, thank God, I need these. I grabbed them
Right.
because I needed stuff to wipe down my car. So every day when I would leave the ICU, we'd have to change into different clothes. I had like my whole process that I would go through because, of course, my fear was bringing something home to my husband and getting him sick. And we just knew so little about it that
Sure.
I was like truly terrified. And to this day, when I smell Clorox wipes, I flash back to me sitting in my car at the hospital on my way home with gloves in my car, wiping everything down, being afraid that I touched something and then didn't clean it again and then touched it. And we talk about how trauma is individual to the person who experiences it. And for me, and this is not a discussion of whether we think COVID is real, because that's your own opinion. I'm not going to argue, but what I'm trying to point out is that that's my reality, right? That was my experience. You can think whatever you want about COVID, but at the end of the day, myself and many other providers were traumatized by what we experienced during that time. So, it's even manifested in me being very reactive when people talk about COVID, because my experience was so traumatic for me that I get really defensive, and I've had to work really, really hard to recognize that sometimes my response is not necessarily even for me coming from a place of like being logical. It's coming from a place of being reactive and trauma. But yeah, I mean, like I said, I would never say that I can exactly understand where some of my patients come from, but I can definitely, empathize with, people. Like, I almost felt like at some points I'm like, am I being like gaslighted? Like, I have people telling me that like something isn't real, and I'm like, but I like lived that. That was what I lived for, months on end. So
and you can put whatever name on it you want.
Right.
It doesn't matter. You can call it, super flu. It doesn't matter what
it doesn't matter. Correct.
It was happening.
It happened. Exactly.
It's just whatever name you want to call it. It happened, right? And you were in the thick of it, and you had no idea what the repercussions were.
No.
And how far reaching it was.
Yeah. And even Brianne knows, like, to
Mhm.
this day, like, even at the office, like,
So
I don't
right?
ask, yeah,
Yeah.
but
Yeah.
ask Brianne, I don't have Clorox
Yeah.
wipes in my office.
Yeah.
I can't, because it just brings me back to this place where not a lot of us can actually have, you know, I genuinely thought I was going possibly to die. Like, I really thought that was like, and it just gave me a whole new level of respect for, I can't even imagine, like, the soldiers that go out there and they do what they do, or people that really do truly, like, you know, are putting their lives on the line. Like, I understand why you see the effects that you see, because it really attacks this part of our brains that's so primitive, right? This kind of fight or
Oh,
flight
yeah.
response. And I think once that's activated from whatever it is, it's very hard to turn it off.
It's true.
Yeah.
I had a situation regarding what I shared earlier when I was growing up, and I really thought I had a handle on it because I understand. Like, I always try to understand. I try to look at all sides. That's just my coping mechanism. I don't really think they're bad people out there. I think they're broken, right? Like,
Yep.
I really do believe that, or they're bad people, but there's a reason.
Yep.
I really, and I don't think there aren't that many people that are, intentionally trying to hurt others. There might be some, and those, whatever. But point is, I had a situation, same. Uh, it came up, something came up regarding that particular topic. And I don't know if I should use the word triggered, but maybe. And I literally became 10 years old.
Yeah.
I felt this was recent. And I felt overwhelmed. I didn't want to talk about it. I started to get sweat, and I had started having all this incredible anxiety. And luckily I was able to talk myself off that ledge. But I was like, oh my God, I still, at this age, I'm still traumatized by that.
Yeah. Well, it's
And,
like,
and
well,
I'm almost in your senior category.
well, you can fight, you
Yeah.
can, run away from it, or some people did like what you did, like kind of froze, and you kind of froze in this moment. Or there's
Oh, I
the
was 10 again.
yeah,
I
yeah,
literally was 10 again. It was like, Hannah, you and your Clorox wipes.
yeah,
Like, you were like, and I was like, I have to remove myself. And sometimes when a situation triggers me like that and I have to remove myself, it's because I then go back. We're circling back. I go back to that inner child
yeah.
that was traumatized. And that's what we do, right?
Yep.
That's what we do.
And we've all been through it. I mean, I don't think there's
Absolutely.
anybody that hasn't been through a trauma. Your parents got divorced, or a
Absolutely.
loss of a family member, a loss of a friend.
I got
We
a
all go
list.
through it. We all, yeah. I mean, we
A
all go
list. We
through
all
it.
have a list.
Yeah, we
Yeah.
all have a list, and it's just,
Mm.
how do you cope with it? How do you cope with these situations when you're in them, so that it maybe doesn't have that ability to elicit such a response years down the road, where you are in that, I'm frozen, or I'm like dissociating from the situation, or I'm reverting back to a certain way in this situation. I think that's the key. I think that's what, we try to do and to help is, well, how do you take these experiences and how do you work through them to decrease your anxiety, to decrease your depression, to decrease, or to have cessation of your substance abuse? How
Well, I was just going to say having a cocktail probably isn't the best thing.
Yeah.
Though sometimes it's pretty good. Sometimes it works,
And
but when it becomes,
moderation.
yeah, like your crutch,
Yeah.
right?
Yeah.
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 I think there's that. But I'm so glad we're doing a 3-part series. So this was just sort of a
Intro.
understanding that, I mean, the next one's that's where the fun's gonna begin. And we're probably gonna have we're probably going to have a lot of conversation there. Um, but I think it's important because we're trying to help everyone. And it's important to have a sense of understanding is why people act the way they do. People are not just born bad, right? They're not. Things happen when they're young or at different times in their lives that shape them, and then they have to manage it, right?
Yep.
Well, I think you're
Nature
right with
versus
this
nurture.
mirroring, this mirroring behavior. Like my dad's dad did it, so my dad thought it was the right thing to do. And, the same is true for even things that they're not healthy behaviors.
Absolutely not,
Drinking, hitting
Yep.
their children, but that's what their dad did. So they're carrying that message out,
Here's
mirroring that
the
behavior.
belt.
Yeah, yeah.
Or in the South, it's the switch.
Yeah, but that's
you
that's what
know,
they saw, that's what they grew up with, so why would you think anything different? Just like in
no,
your
that's just how
situation,
you,
why would you think any life was different until you
yeah,
probably
Right?
started going to other people's houses and seeing, well, hey, like, how come your parents don't do that? Or
yeah,
how come I do this? What's going on here?
what?
But if
Yeah,
you're kind of sheltered from that, you could go many, 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 many years and not
sure.
not know that might result in becoming a traumatic situation.
So I'd like for you ladies, let's do a little bit of an overview of what our next show is going to look like, because I think that that one is going to be very interesting to people when we talk about the different uh, conditions and mental health issues that stem from childhood trauma. Who wants to take this? Brian, you want to start? Hannah, I don't.
I
Who
think
wanted to?
Hannah's excited about talking
I
about
know. Well, we were real excited when we were having mocktails and having our
Yes.
dinner. We did. We were
Mocktails
drinking
are a
mocktails, weren't
shout
we,
out to
Hannah?
Rustico. Yep.
Breon,
Shout
I
out.
don't know
Good for
about you,
yourself.
but Breon had a rough day. Go ahead.
Another trauma.
No,
Another
I know,
trauma.
right? I
You have one girlfriend.
love it. I love it.
All
No,
right, go
I
ahead.
mean, this is, I think, where we're going to talk about some personality disorders, um, mental health conditions. I'm just excited to talk about it, about, narcissism, borderline personality disorder, um, avoidant personality disorder, uh, really truly seeing how these childhood traumas literally affect who people are, kind of like you said. Like,
But it's a
people
protection for them, right? Like they're
want,
trying
and
to
that's what I'm
protect
excited to talk
themselves,
about. Yeah. A
right?
lot of these personality disorders get really, really stigmatized. I think
Oh, sure.
especially borderline is probably one of the ones, people get really, there's a lot of stigma around it. And actually, truly at the root of almost all of these is trauma. And I think the more that we can have compassion towards that, and that's why I'm excited to talk about even this first part, because all of us understanding that, it gives those folks who are struggling and have maybe some of these manifestations of their trauma, I think it gives them a better chance of getting better.
Oh, absolutely. I couldn't agree more because that's what we want, right?
Right.
Because right now I'm telling you, I'll go on, and now it's going to be even worse because we're having this conversation. But like on my social media scrolls on like Instagram and Facebook and TikTok, it's all about these personality disorders and the narcissist and they're evil and they're the devil. And it's like, first of all, there's a spectrum there,
Right.
right? But it's childhood trauma is the reason they're acting the way or behaving the way they are. And you have to wonder, if these people got the proper therapy. A lot of times they won't because they're narcissists. But if they would get right, but if they would get the proper therapy, maybe they would recognize it and things wouldn't look the way they are, and then they would behave differently. And I think all of these all of these things, with therapy can be managed if you're willing to help yourself, right?
Yeah. Well, that's the key. You have to put the effort and the time into it. And, we can say it till we're blue in the face. Like,
Doesn't matter.
this is what you should do. This is what really can help you.
Mhm.
It's not just the pill, it's doing these other things. And, it's just people have to make that choice to put in the work, which I know is very, very hard to talk about traumas, to relive traumas, but you have to have that opportunity to really heal from them.
Yeah, I had a situation where I was speaking with someone not too long ago, and they're like, "Oh, you shouldn't have to go to the past all the time." And I'm like, "But if you go to the root of the problem, you
Right.
might be able to heal,
Mhm.
Right.
because then you'll understand the whys," which I thought was so important that we were covering this on part one, the childhood trauma, right?
Yep.
So, good job, ladies. We pulled it off.
Yeah.
We
Yay.
did. We always pull it off. We were having a few little technical difficulties early on. So many. Yeah,
All good.
I know. I was like, "Oh, we're live. Oh, hello. Hi, y'all. Hi,
Hey, y'all.
y'all. Hey, y'all.
Howdy, y'all.
Yeah. So, right. But I don't have to worry too much because what do I know? Nothing.
No, you know a
Oh,
lot.
No, but
Look
no,
at
all
how
I'm
much
saying
you're
is,
sharing today. I mean, that's so
but
powerful.
you two are the ones that are helping all of us, including me. So even if I don't have it all together, you guys need to.
but no one needs to. I mean, no one needs
I'm
to.
just, yeah,
We're
I
I
all
know.
think
here to
it's
help each other.
yeah, we're all
It's
here just to, to
it's
get it
what you
through.
guys know though.
Yeah.
You know what I mean. But love working with you, and I couldn't pick a better team. We have a lot of fun together planning these shows too.
Yeah.
So because we all have a common goal, and we just want to help people,
Yeah.
and we want to normalize mental health.
Yeah.
That it should be no different when you're going. We should have mental health checkups. I think just like you go to the primary care physician or the gynecologist, or what we should be going to get our skin checked. We should be going and getting a mental health checkup every year, because things change all the time, and we might be experiencing something from our childhood because something triggered it, right? So now all of a sudden we're not understanding, like, why are we depressed? Why are we having issues? Why are we dropping weight? Why are we having stomach aches? If we had a mental health checkup, maybe we'd be able to resolve a lot of these
Yeah.
things.
Yeah.
If it was just part of it, you just got into that habit of having a mental health checkup every year.
And even like day to day in your home, like checking in on your kids, checking in on your
Mhm.
teenagers, are you doing okay? Is everything okay? How are relationships with your friends? Haven't seen so and so around in a little while. Like, is everything okay with you guys? And, or you seem to, not be eating as much lately. Is everything okay? Or you're having headaches every day. Is everything okay? I think as we can do that. We can do that piece of the day-to-day check-ins to make sure our loved ones are okay.
Well, we're going to hear about how messed up we all are in our next show. We're
Thumbs
just going to
up.
be,
Like to
oh,
hear some
yeah.
of those personal stories,
We all have them. There's so many of them. Yeah, and we can share our own too. I'll listen to some of these reels, some people talking. I go, is that me? Did I do that? Oh my god, am I that? Am I this?
Oh, yeah.
Oh
Oh,
no,
yeah.
just no. It's just ADHD.
Yeah.
That's what I do.
That's our new one. Yeah.
Yeah,
Yep.
that's my umbrella. Yeah, it's ADHD. I've been using it a lot lately.
I love it.
I know,
Why
right?
not?
God help us all. All right, ladies, thank you so much.
Thank
I'm
you.
gonna
Thank
buzz out.
you.
We're coming up a little past the hour because we started a little late.
Yeah.
You want to sign off with anything? You want to plug out Seahorse Behavioral? Let's give you guys a shout out.
Yeah, thanks.
What's
And
happening? What's happening there? How do people go see you? Like, how does that work?
Yeah, so we you can find us at www.seahorsebehavioral.com. We are opening a new office next week in Middleborough. Really excited about that,
So
with
happy.
a primary focus on substance use disorder. But we will be doing med management, groups, one-on-one counseling. So there's a ton of resources, but we're really excited, and yeah, I think like
Everyone's
you said, we're
excited.
just trying to help
Right, Brianne?
people
I'm
and
so excited.
normalize this process. So we're looking
Yeah.
forward to it.
Yeah, no, we're looking forward to growing, to meet demands outside of, what we've been doing. And, like I mentioned before, it is National Bullying Awareness Month. So, I think if we can help out in any way possible, if there's anyone going through anything like that, we're here to help. And, as Hannah said, we can go right online and request an appointment. We do telehealth visits and in-person visits, and we also are able to offer some in-home visits for some of our older clients that really just can't get here to the office.
And I've done telehealth um, visits before, and I have to say, um, I actually like them. I mean,
Yeah,
maybe because, well, I use that format anyway. I'm using it right
Yeah,
now. But it is. It's just kind of like this,
yeah,
yeah,
you
yeah.
know.
I think COVID really brought
Yeah.
that out, and and I think even for like just people that are really shy, and it's not mandatory that you have to put your camera on. Maybe you
right.
don't feel
Right.
comfortable with that, and and I think we just try to be mindful of where anybody is. I've had people who
Mhm.
could not put their camera on for 6 months, and then they got to know us, and then they
Aw.
were more comfortable. But
Mhm.
like Hannah, it's you do the healthy at every size, and I think we have so many clientele from just so many different backgrounds, and we try to meet people where they are. So I think it is a great platform if you're just in a space like that where you need the help, but you just can't get out of your situation.
Yeah, no, I think it's wonderful, and I think it's giving mental health to a lot more people that need it.
Yeah,
Oh yeah.
So
Oh
like
yeah.
you're right. So that was a positive of COVID, for sure. But yeah, so ladies, thank you so much again.
thank
Congratulations on
you.
Yeah.
your additional location. I That is going to give a lot of people help out in that area. And yeah, all right,
Thank you.
Perfect.
okay, all right. I will see you
See you next month.
next month. Can't wait for our planning meeting. It's always so fun.
Yeah.
All right, ladies. Thank you so
Have a
much.
good night.
All right.
Bye.
Bye-bye.
Bye. Bye.
Bye-bye. Bye, Bria.
Bye.
All right, everybody. Thank you so much for tuning in. I thought it was a great topic, and we will be back next month with part 2, and we're going to talk about many of the personality disorders and mental health conditions that stem from childhood trauma, and really kind of get in deeper to the topic. So please tune in. I'll start marketing that soon, and you'll have a better idea of what the show's going to look like. But yeah, so thank you for tuning in, and we'll be back soon with another V Talks. Have a good night. Bye bye.